Hello friends, let's talk thyroid. So today we will be discussing about thyroid dysfunction in the postpartum phase. So this is a very common situation where we see that the thyroid function tests often show a lot of fluctuation after delivery. So there are some basic steps where you can remove this confusion and treat the patient in the right way. So the first step is, if the patient, you need to assess the pre-existing thyroid disorder which was there. If the lady was already suffering from overt hypothyroidism and was on a certain dose of thyroxine prior to conceiving, so what we just need to do most probably is to decrease the dose after pregnancy to the preconception dose. So even if they say the lady was on 75 microgram of thyroxine, we had increased the dose to 100. So we can just safely bring the dose down to 75 microgram and recheck the TSH after 4 to 6 weeks. For Graves' disease, what we see is that there is a tendency for going into remission in the later half of pregnancy. So many of the ladies do not require any anti-thyroid medication during the later half, and all these patients they do tend to have a tendency to flare of their hyperthyroidism after delivery. So in all these cases, you need to monitor the thyroid function test closely. The patient might require, there might be an increment in requirement for anti-thyroid medication, and you can safely continue methimazole or carbimazole for during lactation, which are known to be quite safe even during lactation. The other situation we commonly find is subclinical hypothyroidism, which was diagnosed during pregnancy. So in all these ladies, you can actually give a trial of stopping thyroxine right after delivery, recheck the TSH value after 6 weeks or so. If the TSH is going up, if it's more than 10, or if the anti-TPO is simultaneously positive and the TSH in the range of 5 to 10, you can reconsider starting medication. Another disease which is not very uncommon in the setting of lactation and postpartum phase is postpartum thyroiditis. So there is a lot of fluctuation in thyroid function. So initially there is damage to the thyroid gland, and there is a transient thyrotoxic phase that lasts for around 2 to 6 weeks. After that, there can be a phase of hypothyroidism, and in 70 to 80% of cases, the lady actually goes back into euthyroidism. So in all cases of postpartum thyroiditis, you just need to monitor the thyroid function test for the next 2 to 3 months very closely, and many of these ladies will actually go into euthyroidism without much intervention. So this is how you can safely manage thyroid disorder in the postpartum phase and make the newborn as well as the lady happy during the postpartum phase. Thank you. Once again, it was great to connect with you. Thank you.